After completing all the assessments and going through the ONET careers, I ended up picking 3 of them. There was kind of a trend of like professors or somewhere in the medical field, or there were a few special needs worker or working in the special needs education system. But here are the 3 that I picked. So the first career that I picked was a healthcare social worker. So the education that I would need for that is just my master's. Skill would be like social perceptiveness, which is just noticing other people's reactions to, and like why they react the way they do. Then service orientation, actively looking for ways to help or serve other people, which kind of makes sense in that field. Active listening, which I definitely think is probably the most important, just being able to like listen to someone and hear them out, because I think that's probably super important to them, that they have someone that's truly hearing them and not speaking over them. Coordination, adjusting my behavior or reactions to fit the needs of others. Knowledge, psychology, which is just understanding the mind and human behavior, which kind of fits perfectly because my major is psychology. Customer and personal service, so providing quality advice and ultimately working alongside the customer to best fit their needs, and knowing that you're working to improve their health or whatever. The classes that I would need for that are clinical social work methods, psychology, communications, and like sociology. And I can gain experience through volunteering or interning at a clinic or even in a hospital. My second career that I chose was to be a pharmacist. The education that I would need is a doctoral degree. The skills are active listening, so truly taking the time to understand what point they're trying to get across and being able to ask questions to seek more information. Because a lot of times people will come up to the pharmacist and ask questions about certain medications, and I need to be able to answer that clearly, so that they can get the answers that they were seeking for, if that makes sense. Speaking, so public speaking is important, and with the skill will be important when it comes time to speak to the customer as well as your boss or coworkers. So I think speaking in general or communication skills are important in almost every field that you can work in. Critical thinking, using logic and reasoning to solve problems or create new ideas. Monitoring, being able to assess your performance as well as others and knowing how to fix areas that need improvement. Ability and work characteristics. So oral expression, the ability to communicate information clearly and in a way that is easily understood for most people. Classes that I would need for that are biology, chemistry, communications, and experience can be gained through a job at like a local pharmacy, or I even know that CVS will sometimes allow students or aspiring pharmacists to work in their pharmacy, which is obviously great experience. My third career I picked was a cardiologist, so education again is doctoral degree. My work activities, testing the patient's heart or lungs for the level of functioning abilities, operating on patients to treat conditions, and providing health and wellness advice to patients. The skills are just communication, critical thinking, written communications, as well as writing out treatment plans and such. Classes again, biology, chemistry, physics, and I know that I can gain knowledge or experience by shadowing a cardiologist in the hospital, which is something that I did over the summer as well, so I already kind of have that. My results were a little bit surprising, but not at the same time. I got a lot of like sciencey careers, which kind of makes sense because I mean most of the classes I'm taking in the fields that I want to work in are science related. Some of like the professor careers that I got didn't really make sense to me because I don't like teaching and I've never wanted to be a teacher, so that was a bit surprising.